So now that
But
we have a vaccine, doctor, I, as a female, and if I was pregnant, I would be really concerned as to what I should do, because I feel as a pharmacist that we're not seeing that this vaccine has been studied for very long. It's came out really rapidly.
when you use a vaccine, understanding of it, vaccine is not a cure. It's basically helping our immune system to recognize and to fight off an infection. So when we get a vaccine, it's using our body's own natural immune system. Well, from the best that we've understood so far is, okay, if you've gotten coronavirus, roughly it looks like about 90 days. I'm not sure, but it's kind of like we have 90 days immunity and then it starts to wane. Well, if you do a vaccine, the vaccine's utilizing your body's immune system. To say that it's going to last longer than that is hard to believe, because if our own body can't figure it out from the actual virus being in us, then what's the vaccine going to do? So it's like, okay, we don't know how long it's going to last, and from that, I'm just kind of relating it to that. We don't have any definite studies on that. Second thing is too, when as far as rates of, if you get infected, 98, 99% of the time you do well. Well, this vaccine will cover 95% of the time. So are we really covering that 1 to 2% that we're worried about not doing well? And should we carte blanche treat everybody with the vaccine? Give everybody the vaccine, or should we select out the population, do a high-risk population, and try to prevent it from spreading? Maybe then figure out, okay, at that point, do we then offer it to the general population? Even more so, is the risk of the vaccine worth the benefit of preventing and protecting? And in pregnancy, unfortunately, I haven't seen where it says, oh yeah, there's definitely a benefit over the risk, because we don't know the full risk. And if we don't know it for the mom herself, how are we going to relate it to babies? And you'll read, okay, they say, well, the risk of coronavirus is worth the risk of the vaccine. It's like, well, what's the risk? That's what I ask. It's like, okay, it's a plain, simple question. It's not saying, okay, if you told me, oh, the risk of the coronavirus, we kind of are getting an idea what's that. But, is my baby going to be born with 2 heads? We don't know. Or what's that going to affect a baby later in life?